This is the final chapter of the morning drift this morning. And we're gonna do it like this. Let's talk to you about your dental hygiene. Just note that anything that is essentially encompassed within conversations that touch on dental matters. Let me first address it like this. Majority of people fear dentists. So in the studio this morning, we do have DENTMIND in the studio. But let me introduce to you a doctor who is a dentist. Yes, not to scare you though, but to tell you exactly why today, from whatever it is that you're watching us this morning, you just need to get out of the house and say, I'm going to book an appointment at DENTMIND at Garden City Mall right here within Nairobi, so that you can actually start thinking about the importance of being aware about your teeth and every other thing in the mouth. All right, at this point, let me introduce to the morning drift, Dr. MWENDE NZISYA. How are you doing?
I am very well.
Happy to have you around.
Thank you so much for having me around.
Let's begin like this. Let's dispel the fear that majority of people have for dentists. Why a dentist? There's so many careers that you could have gone into and become a doctor in, but then you chose dentistry. Why?
So from when I was a young girl, I think when I was in class 8, I noticed from where I come from, the community, there was a bit of neglect and people were not getting the correct dental treatment. People would be born with brown teeth.
Yes.
People would be born with misaligned teeth. And then it's like, that's how they're branded. You're like, you branded the person with brown teeth. So I wanted to know what can be done for someone, for the community, for you to get a better smile.
Yes.
So I wanted to dig deeper because I realized people were not getting that kind of treatment back then. So I really gained a lot of curiosity on what we can do to better people's smiles. If you have spaces on your teeth, if you have teeth that are not well aligned, if you have brown teeth, what can we do to improve your smile? That's why I wanted to be a dentist, yes.
Wait, so at what age did you say, maybe now, you know how they say, when young people, they want to be doctors. I think you decided that I'm going to be a doctor, but I'm just going to go directly into dentistry. At what age did you then realize, I'm actually going to be a dentist, and that's
I think at that point, I was 17 years old.
17 years.
Yes, I was in Form 4. I went to Staregal Center, and then, there's that form that you have to fill on what course that you're gonna, want to join in campus. And I only selected dentistry. I did not select any other medical course because I knew they were gonna call me for medicine and, because I had all the qualifications to be a general doctor. So I only selected dentistry. And then my second choice was, if I don't get dentistry, then I'm going to be a quantity surveyor. So either I'm a dentist or I'm not in the medical field. Yes. So I was like, I really wanted to be a dentist.
And you were called upon that and you did that course.
Yes. I qualified.
You're one of those students who enjoyed learning because you're within where you thought your calling was.
I love dentistry. Like, I love the core of dentistry. From, I like the way you'll come to me with pain, with some bit of lack of confidence because your tooth is looking like this, your tooth is stained, your tooth is not the way you want it to look. They're not white, they're not looking very nice. So I like how after that you gain your confidence when I correct that. So I love dentistry.
Pretty much. Now, before we even start talking about the procedures that you have at DENTMIND, and I know there are 3, you've classified them into 3.
Yes.
Let's talk about why somebody should not fear visiting a dentist. When I grew up, if you had teeth problems and they tell you have to see a dentist, that was you. You're not going to eat, you're going to sleep for the next couple of days because essentially you're going to visit a dentist. Yes.
So at DENTMIND Dental Center, we practice advanced dentistry.
Yes.
It's very modern. Nowadays we make the treatment very comfortable painless injection techniques. So when you come with pain and you're really scared, like this is gonna hurt, back then when you were told you're going to the dentist, it was really, a lot of work was being done in your mouth.
Yeah, let's just say what it is, meno inaenda
kutolewa ni kama inatumia pliers.
Yeah.
So nowadays things have really changed.
Yes.
For example, when you come and you have pain, we have to inject you. But even before we inject, we do what we call topical anesthesia,
yes,
which is like we have to slightly numb the gum first before we inject, so that your injection is painless.
I see.
Yeah, nowadays
so it's completely changed now, isn't it?
Things have changed. We practice advanced and modern dentistry. So you come to the dentist, some people would be like, oh, like now today, you have to present in the morning, and then I tell you, let's do your appointment in the morning. Then you're like, no, you're gonna ruin my day. And then you come to DENTMIND and you're like, my day was amazing. I had an appointment at 7 a.m. and I was able to go to work. And it's very comfortable nowadays.
Pretty much.
Yeah.
All right. So let's talk about those 3 categories of, I don't know, dental procedures.
Yeah.
And who is supposed to go for all those 3 categories?
Okay.
Yes.
So mostly we categorize them into, we have cosmetic procedures.
Yes.
So basically cosmetic is procedures that we do to make your smile better. We have what we call teeth whitening. The people who are born with fluorosis. Fluorosis is on the rise in Nairobi. So
why do you think it's on the rise in Nairobi?
Fluorosis because of the use of borehole water.
Okay.
Yeah, and the salt content, or rather the fluoride content in the borehole water is not regulated. So you find kids are being born with stained teeth.
I say that now.
Yeah, stained teeth.
Occurring naturally.
Yes, occurring naturally.
Even before they test this water and all that.
Yeah, so you find like your bone and then your teeth. Actually, moms have been coming and they're like, oh, my child is at the age of 7, 8, and they've noticed that the permanent teeth are coming up with staining on their teeth.
Yes.
So they want their teeth to be brighter. So we do teeth whitening. And teeth whitening is usually, it ranges from, using the light activated teeth whitening procedures, doing the veneers, and also, what we call masking. So it's a wide range of procedures that we do to whiten your teeth.
Yes.
We also have people with malocclusion. Your teeth can have spaces or they are a bit crowded. So now you need to align your teeth. You want them to be straight. So now we do braces. And braces, there is a wide range of braces. We have the conventional ones or the metallic ones.
Yes.
Like the ones I have. We also have the clear ones.
Yes.
The ceramic ones. They are like bright. They are not very visible. And we also do the Invisalign, which is like clear aligners for you to arrange your teeth. So it's a wide range of treatment plan for you to get your teeth corrected. We also do implants. Implants is when you have a gap on your tooth. This is mostly for adults. Some people come and they're like, Doc, my wedding is in 3 months' time. I have this gap and I don't want it, and I want something fixed. So we're able to put for you implants, and by the time your wedding is coming, you have that perfect smile. So yeah, we do a lot of that.
Who's going to be open to an implant?
Implants are done for adults.
For an adult?
Yes.
Is it a quick fix to an issue that I would have in my teeth?
So what happened for implant is it's a replacement.
Yes.
It's a fixed replacement.
I see that.
So let's say you have a tooth that's missing,
yes,
like a premolar. You have a gap there and you don't want it to show. So we put that implant, which is like a tooth. It's like putting a tooth where that one was, and
yes,
then you're fixed. You
yes,
don't remove it at night. It's something that's fixed,
yes,
on your teeth.
Pretty much.
Yeah.
So our audience already has that. Could you explain? We do have the pictures on the screen right now. Just
yes, want
you to actually have a look at it,
yeah,
and explain that.
So you can look
yes,
at, you can see that person has a missing incisor.
And that's an adult?
That's an adult.
Yes.
Because we only do implants for adults.
Yeah.
So what happens now? You come, we
yes,
take measurements for the missing area.
Yes.
And then we plan. We have X-rays that we take,
okay,
so that you're able to assess your bone, the density of your bone.
Yes.
And then we do 3D analysis of your bone, of that area.
We're going to talk about 3D as well.
We're going to talk about the 3D analysis
yes,
of that area.
Yeah.
And then once we have the measurements correct,
okay,
because there's a lot of details that have to be done.
Yes.
You see the after, the way it looks very natural.
It looks very natural. Nobody can know that
nobody can
there's a
know.
replacement in there.
Yes, so
yeah,
we have to do all that measurement so that by the time we are done,
yes,
you have the final outcome. So the first stage is usually putting the implant, which is, it looks like a screw. People usually tend to feel like it's painful, but it's painless.
There's no pain?
There's no pain.
Yeah. Okay.
Dentistry, it's pain. I insist on the word. It's painless. Nowadays, it's painless.
Yeah.
So you can put the screw, which is basically the root.
Yes.
And then you get the permanent crown in like 6 to 8 weeks.
That's it.
But
how much would that process cost?
Implants usually cost, the whole process will cost like around 180,000.
That's 180,000.
Yes, yes.
Would you say that at DENTMIND, you could be one of the best services for that particular procedure in the country?
Exactly.
Why would you say so? Yeah.
I would say that DENTMIND is the best place to get this service first, because
Yes.
we have a whole team
That's it.
of doctors on board. We have consultants, and we also have general practitioners.
Yes.
So we are like 6 doctors on board. And then we have fully equipped our center
Yes.
for this kind of treatment. So when you come, it's like a one-stop shop. You know, you will come, you'll get the diagnostic procedure done, you'll have the x-rays done there, we'll have the measurements taken there.
Yes.
So there's no like a lot of movement. So you're there and you will get that procedure done there.
Pretty much.
Yes.
I want to take you back a little bit, just
Yes.
a little bit before we even talk about what we have on the table right here. When you mentioned about teeth whitening,
Yes.
the people who've complained about their teeth becoming numb or extra sensitive once they went through the teeth whitening procedure.
Okay.
At DENTMIND, what is it that you do that essentially is not going to have other reactions after my teeth have been whitened?
Okay, so at DENTMIND we have, as I've explained,
Yes.
we practice advanced dentistry, and before we actually do a procedure on a patient.
Yes, we actually have it on screen as well,
Yes,
so you could speak in
learned-
respect to that.
Yes,
Yeah.
we've learned through the whole procedure. We know the materials that you're using.
Yes.
So first, when you're getting this teeth whitening procedure, you have to get a desensitizing agent.
I see that
We
now.
have to desensitize the teeth, okay,
Yes.
before you do the teeth whitening, because the gel that we use actually, it's a bit, I would say it's a bit corrosive, it's a bit harsh. Then it's supposed to only touch the teeth, the gel, when it's being used. So you cannot have that gel touch any other part of your mouth.
Other than just the
It's
teeth,
just the
isn't it?
tooth, okay?
Yeah.
So we do the desensitization before and after.
That's it.
Yes, and then after that we also do what we call, you also go home with the gel, the one for desensitization.
And
So
I'm taught exactly how to use it.
you're taught exactly how to use it.
Yes.
The other thing that we use is the materials that we use.
Okay.
They are materials that have been studied, and they are the best for teeth whitening.
I see that.
You know, you have to come to a qualified professional for this kind of whitening, because you have to know the product that is being used.
Okay.
And in DENTMIND, what is used is a product that has been studied, and it's correct for teeth whitening.
Pretty much.
So after that,
Yes.
the kind of sensitivity that you get shouldn't even last for more than a day.
Oh, yeah?
No, no.
After the procedure?
Yes.
And there's another question here as well. How many procedures do I need for my teeth to look like that?
Now, this is dependent on the patient.
Okay.
Because there are people who have brighter shades, there are people who have darker shades.
Yes.
So some patients will come for one stage.
And they're fine?
Yeah, we only do 2 cycles or 3 cycles.
Okay.
Each cycle is 20 minutes.
Yes.
And they're fine. There are people that will give another appointment because their shade was a bit darker. So it needs another appointment in 3 or 4 days.
That's it.
So by the time you're done with the 2 sessions, for someone with darker shades, they're done.
Pretty much.
But some people will just need 1 session. Yes.
All right, let's talk about the cost at DENTMIND.
Yeah.
How much is a procedure for my teeth to look like what we have on the screen now?
So this kind of procedure is called blue light activated teeth whitening. We just use blue light. We're also going to start using laser in the next 2 weeks.
Okay.
Laser is also very good. So this one takes like 1 hour, and the cost is usually 30,000, although it can be higher depending on
Yes.
on your shade of teeth. It
Yes.
depends on how many cycles you're going to use. But basically, the basic is 30,000.
30,000 per
Yes.
procedure, isn't
Yes,
it?
yeah.
Fantastic. And you would say that your prices are pocket friendly in the
Very
country?
pocket
Isn't it?
friendly.
Yeah.
Yes,
Pretty
yes.
much. All right. Now, just before I'm getting told that we have a couple of live calls that are coming into the studio right now, just on this particular one. We don't have a model here, by the way.
Yes,
it's not just about, teeth whitening, and we're going to talk about 3D and 2D
Yeah,
imaging
yeah.
shortly after
Yeah.
that. It's about knowing exactly how to brush your teeth as well.
Yes.
And I see you have an electric toothbrush here. We'll be talking to you about that as well.
Yes.
Could you show our audience exactly how to brush your teeth the correct way?
Okay, so this is very, I like this question because this is very basic. Okay. And I think everyone needs to get it right.
All right.
You know, so that you're able to take very good care of our teeth.
Yes.
So I'm going to use the electric
toothbrush.
Toothbrush because the reason why we emphasize on this one is because it's very effective and then it can be used by everyone. You know, even people who are challenged, people who are older, you know, because it just runs on its own. You don't have to, like, let me just compare with this one. This is the kawaida toothbrush that we use at home. So for this one, you have to do a lot of, you know, you have to do the motion.
Oh, the tongue is upside down. Sorry. Somebody would have said that you're supposed to.
Sorry for that. So so now for the electric one, for this one you have to do the circular motions. For the electric one, you don't have to do anything. You just need to turn it on like this.
Yes.
And then you just press it on the tooth.
I can see that.
And then it does the motion. It does the motion.
Oh, it just does the motion from the foam part just
it
by
does
itself.
the motion. Yes. Because ideally you should, when you're brushing, you're supposed to position the toothbrush at 45 degrees, okay? So that it's able to get to the, like, go deep to the gum a little bit. And then it's able to be brushed very effectively.
Yes.
So for a manual toothbrush, you have to do the circular
by
motion.
Yourself, isn't it?
For the manual. And you have to remember it's a circular motion. Some people do horizontal, and it's wrong. You end up traumatizing your gum and traumatizing your tooth. So it has to be a circular motion. Yes, for the manual one.
For the manual one?
Yes.
Hold on, I've been doing it wrong.
For the electric.
Jesse, I've been doing it wrong.
You've been doing it wrong.
Hold on, has to be circular.
Yeah, it has to be circular. People do it wrong all the time. So you have to do, it's like a circle, it's a circular motion. Don't do like this. Don't do that.
I've never got it. I've never got it.
So you traumatize your gum, and then that force is usually translated to your tooth.
That's it.
So you end up getting what we call abrasions or
pretty much.
Yes.
Now, here's the thing. There's somebody online right now that just want us to actually speak to at this particular point, just as we continue learning that particular model. Could you please tell us where you're calling from and who you are and what question that you have for Dr. NZISYA? Can you get us hello?
Hello, hi.
Hi, how are you doing?
Morning. I'm easy.
Thank you very much. Could you please tell us your name, where you're calling from, and the question that you have for Dr. NZISYA?
Okay, my name is Keith.
Yes.
Apparently, I've been following up your show, and I have a question. Maybe you guys can sort me out.
Thank you very much. Ask away.
I've been having an issue with my molars, molars teeth. Anytime I drink anything which is hot, it's like I have a sensitive. I have a sensitive tooth.
Yes.
I don't know how you can help me out because I've been told time to time, clean my teeth, use some wash guards during the night.
Yes.
But, there have been no results at all.
There have been no results. That's a direct question to you, Dr. NZISYA. Is asking, well, I have a problem with my sensitivity every time I take something hot. Is that something that you help solve at DENTMIND?
Yes,
and what is the solution? Should Kit then approach you guys?
Okay, I really love this question because when I'm answering it, I believe I'm reaching the community and people are able to get this information and get it right. Okay, so when you have a sensitive tooth, there are multiple causes of sensitivity, but the most common cause of sensitive tooth is a cavity on the tooth. Okay, so what happens during a cavity formation? The tooth is a whole structure made of, you know, the upper part, the enamel, which is like, it's the hardest part of the body. Can you believe it? Actually, they say when you're brushing your teeth, that is the only time you're able to brush your skeleton. So the enamel is the hardest part of the body. It's harder than bone. Okay.
Oh yeah.
So when a cavity develops, it starts by breaking down the enamel. Okay. And the enamel is also non-living. So at that point, you don't feel any sensitivity.
You actually don't get to feel any when it's breaking down.
Yes, when the enamel is breaking down.
So you can actually say, well, my enamel is breaking down because you don't feel it, Dr. May.
At that time, you're not feeling it. Then now when you go deeper, after the enamel, you go to the part that is called the dentin, which is now after the enamel. So now the cavity, we call it, it's a non-reversible. A cavity, once it stops, it's progressive. It just continues deepening. Okay?
Yes.
So now, that time when you're feeling sensitivity, we've reached to the dentin. And the dentin is a living part of the tooth.
Ah,
okay?
I see now.
So that point, you're feeling sensitivity.
Oh, you start to feel the pain now,
yeah,
isn't
because,
it?
yeah, because the dentin is getting irritated.
Yes.
Okay? Then now it depends. And now you start getting pain. Because after the dentin, we go to your nerves.
I see now.
So now when you're getting pain, the cavity has already gotten to your nerves. Okay. So now he's experiencing sensitivity because there is a break in the tooth, what we call a cavity.
Yes.
And the nerves, or rather, sorry, the dentin is being, it's being irritated.
Yes.
So at this point, we recommend you have to go to the dentist and get that cavity filled.
Yes.
Okay. When there is sensitivity, because we don't want you to start getting pain, because at that time you're in the nerves. And when you're in the nerves,
yes,
we do a root canal.
That's it.
Okay? A root canal is a bit more invasive.
Yes.
So we say, every time you get sensitivity,
yes,
go to the dentist.
That's it.
And people are doing it wrong because when you have sensitivity,
yes,
they want to self-medicate.
I want you to hold on your thought right there because we have another call. Just remember, we'll be asking you exactly what procedure then you'll be doing on that particular sensitive patient. Yeah. All right, good morning. Where are you calling from? And what question, yes, do you have for Dr. MWENDE?
Good morning. I'm calling from Nyeri.
Yes.
I have 2 questions for the doctor.
What's your name? What's your name? Kindly tell us your name.
Sorry. My name is Dorcas.
Yes.
I'm calling from Nyeri. And I have 2 questions for the doctor, kindly.
Ask away.
My baby is 6 years old. And he has started removing his milk teeth.
Yes.
Now the milk teeth were well aligned, but now when he has permanent teeth, they are growing with a gap.
Yes.
That's the first question. And the second question is, why would milk teeth grow? The baby has not been taking any sugary stuff.
Okay.
Yes.
Fantastic. Thank you very much, Dorcas. So here's the thing. I want you to continue then responding the first question for Kit right there. What procedure are you going to help him with at DENTMIND? How much is that going to cost before we respond to Dorcas' question?
So he has to come for consultation.
Yes.
Our consultation is 1,500. And then after that, we usually take x-rays. We do the, for fillings and such a complaint, we do the 2D x-ray, which is an OPG. And then we'll do the fillings. And each tooth is usually 6,000.
That's 6,000.
Yes.
And that filling is once?
That filling is once.
For a lifetime? Is that what you're saying?
We usually say once you get a filling, you have to keep visiting the dentist at least every 6 months for cleaning and checkup, because we need to take care of that filling. Otherwise, it can last you for a long time.
Pretty much.
Yes.
All right. Let's talk about Dorcas' issue then, just before we continue with this process.
Yes.
Has a baby, was 6 months old, but then there are gaps in the teeth, and there's an irregular growth of the teeth when indeed the kid is not even taking sugar. Let's respond to that.
Okay. So at the age of 6, the teeth are just growing. So probably at that time she's shedding the lower milk teeth, the lower 2 incisors, and then the permanent ones are coming out.
Yes.
So at that time, there's a lot of the teeth usually can come in any direction because they're still coming up. Okay. So we don't even do any intervention at that age.
Yes.
Because it's still early. Again, at that time, it's okay to have spaces in between the teeth because they are just coming up in any direction. But we usually monitor and for sure know if there's a gap by the time she's around 8 or 9. And if the gap persists by the time she's 12, then you're able to correct with braces.
Yes.
So at this age, I wouldn't really, it is not like an alarm.
Yes.
I wouldn't want her to be worried, but she can always come for checkup.
That's it.
Yeah, for reassurance.
Particularly. Now, here's the thing. I've got another question again that we're going to have to respond to. I've floated the link right now, and there's somebody who's asking this question. It's on braces, by the way. Yeah. All right, Collins, thank you very much. You've been watching this morning. Thank you very much.
Yeah.
Buy you breakfast after this. All right, this is what they're asking. Why do I need braces? I've seen a lot of people with braces. How much do they cost at DENTMIND, and what is the procedure for getting the braces?
Okay, so we do braces because we want to align your teeth. Like when you come, and you know some people will tell, Doc, my teeth are crooked. My canine is up there, because that tends to happen a lot. I have an open bite, but you try to bite and your teeth are not together.
Yes.
Like your teeth are supposed to bite like this. Sometimes you bite and they're like this, you know. Sometimes the jaws are not biting properly.
Okay.
So
and these are natural.
Sometimes you have gaps in between the teeth. You want them closed.
Yes.
Because some people have this mwanya, So braces is a matter of you feel like your teeth are not well aligned.
Yes.
And then you want them to be aligned.
That's it.
Anything that causes that kind of misalignment, you need braces. Okay. So people are not doing braces for fashion or they're doing braces because they want their teeth better. And then, you know, when you were born, it's not for fashion. You know from where we come from. This information about braces, our parents didn't even know.
They didn't know.
But right now, we are educating everyone. And I like these shows because we get to reach so many people.
Yes.
We need you to know if your canine is on the, it's not online. If you have a gap, if your teeth are looking crooked, I want you to know that they can be corrected. You don't have to stay with an ugly smile. It can be corrected. So people are doing braces to get a better smile. Because the smile is part of your face. It makes you better. It makes you look beautiful.
Pretty much. So how much they cost, how long do you have to stick with braces until I feel, well, everything is fine?
So right now, actually, we have an offer for braces. We are starting with 100,000. And then some cases, of course, can cost more, but basically from 100,000, and you're able to get your braces.
That's it.
Yes.
For how long do I have to stick with the braces?
It depends on the case. Some people, their cases can take shorter for like 8 to 12 months. Other people will go even up to 2 years.
Yes.
It depends on what you're correcting. I can't tell every patient that your
this
case
is exactly
this
what
is
it's going
12
to take,
months. No.
Yeah.
It depends on what I'm correcting for you because some cases are easier, others are a bit complicated. So it depends on what you're treating.
Personal question on the braces.
Yeah.
Do I have to change the way that I conduct myself around foods when I have the braces on? Do I have to change the way that I even brush my teeth when I have the braces on?
Very good question. So when you have braces on, your eating habits change.
They do?
Yes. You have to you have to go to soft diet. You have to stick to meals that won't plaque the brackets. Because if you have akuna miwa, akuna groundnut, akuna cashew nuts, akuna macadamia nuts, akuna crisps, those akuna, those nyama choma. You're not going to be doing that until you're done with the braces. Because what happens when you bite on something hard, it's gonna come out. Okay, and then when it keeps coming out, you're slowing down your treatment.
The process of treatment.
So you have to stick to soft meals. Okay.
Yes.
You also have to be very thorough with your brushing.
Yes.
You have to use the toothbrushes, and then you also have to use this gadget.
Yes.
This is called a water flosser. It's very good when you have braces. We also recommend it for everyone because it flosses your teeth. It comes with put some water here, and then it comes with pressure, so you're able to clean better. You're able to floss better.
Yes.
This is a water flosser. It's not a toothbrush. So you still have to brush, and then you have to come to this gadget. So your brushing techniques, again, your brushing habits, they have to be more thorough with braces.
With braces on, isn't it?
We don't want you to get gum disease with braces. We don't want you to get cavities when you have braces because it can easily happen. Braces, they trap a lot of food, so you have to be very, very thorough with your brushing.
Pretty much.
Yes.
All right. So let's get back to the cleaning process. I'm going to ask you how much this device is by the cost, the electric toothbrush and this floss as well. So you said it's round motion.
It's round motion.
It's not up, down, it's not.
It's a small soft circle. And the reason why we say it's a round motion is because when you look at your gums, it's like a semicircle.
It is.
So you need to follow that. When you go horizontal, you're actually changing the anatomy of your gum. So you traumatize your gum. So it has, please, everyone.
It is round, circular motion.
Yes.
It's not up, down.
Don't do that.
Hold on. I gotta ask you this, Dr. Bernard. Do you know that we learned how to brush your teeth? There's that, I think in the 844 system it was there. So you're actually correcting it because we're told brush up, down, sideways.
I am correcting it now because I need everyone to get it right. I need you to keep your tooth until you're 60, until you're 70. That is what we want you to do. Yes.
Fantastic. Let's go into the next area of our conversation this morning, which I know is going to touch about 3D and 2D imaging.
Yes.
When did you fall in love with this procedure? How old is it in your particular segment? And if I come for it at DENTMIND, then why should I come for it?
Okay, so this is the 2D imaging is usually the most basic X-ray that we take for everyone when you're coming for checkup. We have to take it because we need to see the general, the general outline and the general view of your teeth.
Yes.
It's also able to pick. Sometimes you'll come with a painful tooth, and then I do the 2D X-ray. It's called an OPG, and then I see the painful tooth and I see what's actually ailing you.
Yes.
and then now I see something else.
That's it.
On the other teeth, I can go and find that you have other cavities, because the x-ray will show me. I'll go and find there was a developing cavity on the other tooth. I'll probably go and see that your wisdoms are not coming out properly. So it captures, you know, your whole dental formula.
Yes.
And that way I'm able to plan better with you. I'm able to tell you, so today you came with your painful incisor, we're going to treat this incisor. But then after finishing that incisor, you need to come back. We correct the other problems. Because when they're detected early, we are able to prevent rather than treat. So it's a tool that makes me, when I'm treating you, it makes your treatment more comprehensive.
That's it.
I'm able to give you a plan that is long lasting. So we like that kind of you know, approach. We also do the 3D X-rays. It's a bit advanced. It's a modern technology. Now the 3D X-ray will show me, you know, your 3D, your all corners of your mouth.
Yes.
If I need to do the way I was explaining, if we need to do an implant, we need to see your bone.
Yes.
Because the implant, if you're missing that tooth, I need to see how much bone is on the inside, it's on the side, on all angles, so that the implant goes to the exact place where it's needed.
Yes, and that's what we're showing on the screen right now.
Yeah, we also need to like know, you know, any other like the nerves, you know, where the nerves are, so that we don't cause trauma to the nerves. So it's a very advanced tool that we have, and we like it because that way we're able to give our patients the best dental care.
Pretty much.
Yes.
I'm going to give you 15 seconds because we're stepping out now.
Yeah, okay.
How have you made it easy for somebody to book an appointment, to talk to you, to approach you, and track their progress at DENTMIND?
We have our platforms.
Yes.
We have our website, DENTMIND.density.ke. You can book an appointment on the website. We have our social media, you know, handles. We have Instagram. You can book through Instagram. We have Twitter. We have Facebook, and we have our contact. It's always like it pops up everywhere. When you see DENTMIND, you'll see our contact.
Yes.
It's 0705 555 088.
That's
so,
it.
yeah, you can always call and you'll get an appointment.
That's it.
Yes.
Dr. Mwende, thank you very much for visiting us right here on The Morning Drift, and most especially Lookuptv. It was a pleasure speaking to you. In fact, we're getting an appointment, and one of those people suffering from a lot of spaces in my teeth. Anything that I eat sticks, regardless of what it is. All right, now you do know. Talk to them at DENTMIND. In fact, you Google that, that's DENT Mind. They're gonna pop up. I actually have everything that you need from them. It's right here. Their Instagram, their LinkedIn as well. They're all over, even at their website. That's www.dentmind.com. All right, that's exactly how we end today. Thank you very much for being a part and parcel of this particular session, all the way from 7 a.m. in the morning up to now. Good morning. My name is SIMBA, Elijah Charles KIAGE, and goodbye. We'll see you tomorrow for another section.